Hi guys, thanks for doing our training on the pandemic plan and the COVID-19 response. So this information is coming from the Centers for Disease Control and Prevention, World Health Organization, Wisconsin, DHS, and the American Medical Directors Association. So we're going to go over the current pandemic and special considerations for nursing homes. We serve a very vulnerable population to this disease. We'll talk about prevention and safety, Moral Homes interventions and why we're doing them, why they're important, and some droplet precautions, types of PPE, how to put them on and take them off, and what we're going to do if we do get a COVID-19 case or outbreak. So the World Health Organization defines a pandemic as the worldwide spread of a new disease, and that's what COVID-19 is. So we know about coronaviruses. We've seen coronaviruses before. They're known to cause respiratory diseases in humans, but usually they just cause like a cold. COVID-19 is causing some pretty severe respiratory cases, especially in older folks. It's a new coronavirus strain, and it can lead to complications like pneumonia and sepsis, multi-system organ failure, death. So it's pretty serious, especially given our population. It's pretty much all over 65. So some people are calling the COVID-19 SARS-CoV-2 because it's similar to the type of coronavirus that caused the SARS outbreak in 2003. So we have seen a coronavirus like this in a couple different cases before, where there have been pretty widespread illnesses. SARS in 2003 and MERS in 2012. MERS didn't really get to the United States, with the exception of a couple people who are working in the Middle East and then contracted it and came back, but that was a still pretty big one. So COVID-19 has an incubation period of up to 14 days. Most people show symptoms within 4 or 5 days after contracting the illness. So there's an exposure, and then the majority of people 4 to 5 days after that exposure, if they've gotten the illness, they're gonna show symptoms, but they might not. 97.5% of people showed their symptoms within the first 11 days, but there are a few that didn't show symptoms until day 14. So it's spread through droplet particles, direct patient contact, and through indirect contact with infected surfaces. They're picking it up. Our research is saying that people are shedding the virus in feces, so it can also be spread via the oral fecal route. So this is the link that you're seeing. You can type that in. That's the CDC's link on preventing getting sick from the coronavirus and how the coronavirus spreads. So one of the issues with the coronavirus is that even though people can go for quite a while without showing symptoms of that virus or symptoms of illness, after an exposure, after you've contracted the disease, even if you don't have symptoms yet, or you don't show symptoms, some people don't show symptoms at all, you can still spread that virus to other people, which is one of the reasons that this is spreading so fast. It's because we kind of naturally back away if we're standing next to a sick person in the store and they're coughing and hacking everywhere, but you're not really suspecting that someone is ill if they are shedding this particular disease and they don't have symptoms yet. But you're more likely to get it from that person because you're not, really worried about them. But anyway, a symptomatic coronavirus presents usually with a fever, a dry, non-productive cough generally. Most people have fatigue. They don't want to eat, not hungry. They'll have shortness of breath. If someone has severe shortness of breath, that would be indicative that you would really need to provide some sort of quite a bit of medical attention. So there was training that DHS put out that wanted caregivers to know if residents or people are in that tripod position where they're trying to get a breath, and so they put their hands on their knees and they're kind of bent over because they're so short of breath, that would be indicative that you would need to tell your nurse. Some people did have sputum production. Most of the coughs were non-productive though, and then various myalgias or muscle pains. But not all patients are going to present like this, especially patients with compromised immune systems or patients who are otherwise healthy. Super healthy. Kids aren't showing a lot of symptoms, or at least not a lot of severity, which is one of the reasons they can't visit right now. But in general, pretty much you're gonna present with a fever. If you have a compromised immune system and your body can't mount that immune response, which involves a fever, you might see some of these other things. We're screening our residents 3 times a day, every shift. So really any change in condition is something that you'll want to try to pick up on. But certainly any respiratory symptoms you're going to want to be watching. If a resident develops respiratory symptoms, you're going to need to implement droplet precautions. And call me your M. COVID spreads really quickly in communal or congregate living situations with shared ventilation. So just because of how rapidly the coronavirus did go around the cruise ships that people were on through the ventilation and stuff, we believe the virus is somewhat airborne. Still, though, it's more going to be aerosolized so it's going to live in the air after somebody coughs, could live in the air for a couple hours, or if you're doing an aerosolizing procedure. So a nebulizer will aerosolize the virus. Even oxygen use to some extent aerosolizes the virus. So really, if you can avoid doing nebulizers, if you can switch residents to inhalers, or if you can ask their doctor to look into it, they have to be able to actually understand the concept of the inhaler for it to be effective. But really we want to try to avoid those aerosolizing procedures. CPR is an aerosolizing procedure. Also, you're gonna notice that there's some new policies coming out in relation to how to take care of a resident who's passed away, changes to the policy on how to do CPR in the event that that person is infected with the coronavirus. Please make sure that you're reading these policies as they come out. But like I said, so COVID spreads quickly on those cruise ships. Nursing home is a congregate living situation. It's got shared ventilation. So it's likely that if we're not very, very careful and try to prevent bringing it into the facility in the first place, that it would spread very quickly here. So that's why PPE and stuff is so important. Age and comorbid conditions are predisposing factors to the severity of the disease. The older and sicker someone is, the more likely they are to develop severe symptomatic infection with a higher mortality rate. I think the mortality rate most recently for people who are over 80 was about 15%. That's really high. So prevention is key here. But we also want to make sure that when we review these residents, we're quickly identifying symptomatic residents so we can isolate, implement precautions, get them tested, and just reduce the risk of transmitting that disease to other people. So, complications, obviously, pneumonia, sepsis, respiratory failure, heart injury, kidney injury, complications from prolonged immobility. This is hospitalization, but I took it from the CDC. It's a quote. So like pneumonias from bacterial infections or skin infections, pressure sores, there's all that kind of stuff. We're going to talk more about treatments and how we'll take care of people in-house, just in case we do get the disease, but we'll talk about that in a different video. Again, you can go to the link that I have down there. You can type it in, write it down, whatever, on clinical guidance on managing patients with COVID-19. So we have a plan to protect our staff and our residents from this disease, which primarily involves following these CDC guidelines and the DHS memos. I know that it's probably pretty frustrating when new policies and procedures and information is coming at you all the time. It's a lot to take in, but it is a requirement for stopping or at least trying to decrease the risk of transmission of this illness. So got to follow the CDC and DHS guidelines. Doing the staff screening when you come in, please be honest on the screening. Check your temp, make sure that you're healthy and fit for duty. Monitor the residents. You know that residents can get sick very quickly. Notice those changes in condition. Follow the droplet precaution, contact precaution requirements for new admissions. Get those droplet precautions implemented if your residents develop respiratory symptoms. Do your hand washing, don the correct PPE. The droplet precaution signs have pictures of that PPE that you need before going into the rooms. Put it on in the correct order, take it off in the correct order. We're going to go through that. Reduce or eliminate ER and hospital visits, cleaning, consistent assignments, and we'll talk about the isolation unit a little bit. So the CDC says to stop all communal dining and activities, and that's important because the disease is a lot more likely to spread rapidly if people are close together. This doesn't mean that we're restricting everyone to their rooms, but reducing each contact is important, or limiting the number of contacts is important, because every contact, and this goes for our staff too, every contact that you have with another person is a potential exposure. So if you think about the fact that when you go out, if you don't, not the residents, but our staff going out to get groceries and gas and all of those things, if you go out and interact with 10 people, even though everyone's kind of following all of this sanitary and cleaning guidelines, if you interact with 10 people, you've just had 10 exposures to this virus, and you're probably not going to show symptoms for 4 to 5 days, and you can spread that virus in that 4 to 5 days to our residents. So, like I said, the more interactions you have, the more risk of exposure that you have. So we stop communal dining and activities at the recommendation of the CDC and DHS, because if people are farther apart, they're less likely to transmit illness. One case can quickly turn into 20 if an infected person is in close proximity to a bunch of other people. Also had to stop all unnecessary visits and visitors. So our county has been affected, Monroe County has been affected by community spread, and that means that people in our community have COVID-19 and they don't have any known exposure to another confirmed case. So there's people in our community who have this virus and are spreading it to other people, and they might not know they have it yet, or they might not know at all. They may have an asymptomatic infection. So because our residents are such high risk, we can't allow visitors to come in and increase that risk of transmission in the event they have an asymptomatic or pre-symptomatic infection. And we are really asking and encouraging staff to follow the safer at home orders and make sure that you reduce your risk of exposure as well. Early identification and the implementation of interventions is how we're going to be able to protect people. So do your screening. You're less likely to become seriously ill as a staff member from this, but you might expose somebody that would end up very sick. Again, monitor your residents. They can change quickly. Do it 3 times a day. If they develop symptoms, take steps to put the resident on isolation precautions and, protect other residents and protect those staff. There is a checklist that came out, a policy that came out on how to activate that isolation unit on first floor west wing. Please make sure that you are taking a look at that. If a resident tests positive for COVID-19, they do need to be immediately transferred to that isolation unit. We can worry about whatever else we need to do, what the family wants, what the care plan's going to be, but immediately upon a confirmed or suspected COVID-19 case, we have to open up that isolation unit. If a resident develops symptoms, stop what you are doing. Do not finish your med pass. Do not finish getting vitals. Do not keep on doing the tasks that you are doing. Stop what you're doing. Ask for help and put the resident on precautions. And call me or M to let us know. We'll go through assessments and next steps with you. We have the same checklist you have. So basically we're just going to be going through and making sure we hit all the steps. But we do want you to call us and let us know that you're implementing droplet precautions for somebody. I sent out an email letting you know where you can get PPE. So if you have any questions on where you can get it, please let me know. You guys have access to it all the time. And we need to make sure that you have what you need to have if you have to implement precautions. Okay, we'll go over hand washing, obviously part of our plan. Effective hand hygiene is still very good at preventing the transmission of COVID-19. And we uploaded some super fun videos to YouTube that you may have already watched, but we are going to check them out again.
Today we're going to review basic hand washing, just as a nice reminder. Hand hygiene should be performed anytime prior to putting gloves on, after taking gloves off. The first step is turn the water on, get your hands wet, apply some soap, and we all know that the correct amount of time to scrub your hands is 20 seconds. Paying close attention to getting the fingertips around the back of your hands, around your thumbs. Those areas are frequently forgotten. In between your fingers, if you have a wedding ring on, minimal amounts of jewelry are okay. So you can sing happy birthday 2 times, you can say the alphabet. There's a number of songs out there right now. And there's my 20 seconds, so I'm going to finish up. Water doesn't have to be hot, warm is fine. Get them nice and rinsed. Always let the water kind of drip down, you don't want to shake it too much. Paper toweling. Dry your hands off. Grab another paper towel and shut off the faucet. Once you've completed all of that, you are good to go. Okay guys, second part of our hand hygiene is using alcohol-based hand sanitizer. I love it. It's awesome. It's everywhere in our facility. I don't care if you use your own from Bath & Body Works or Walmart. As long as it has 60% alcohol, that is the only really important thing to know. So after you take your gloves off or before you put them on or anytime in between contact, you want to go ahead and 1 squirt of hand sanitizer, about a dime size. And you're just going to apply that, rub it all over your hands, in between tops and bottoms, until it dries. Doesn't take long because the amount of alcohol obviously evaporates pretty quickly, and then you're good to go.
Alright. So, COVID-19 can spread both directly through the droplets of an infected person coming into contact with someone's mouth, nose, or eyes, and indirectly through infected surfaces. Probably. We don't actually know for sure that can happen yet, but we're pretty sure. Amounts of the virus can live on surfaces. I've heard different lengths of time, but a general rule is about 72 hours. So, some research is saying that the infection might also be able to be spread via the fecal-oral route, and if you've seen those videos of children licking toilet seats, I would strongly encourage you to talk to your child and make sure they are not engaged in that awful, potentially lethal behavior. That is rough. Don't do that. The bottom line with hand washing is that clean hands don't spread bacteria and germs and viruses, whatever else, to another patient, and you're a lot less likely to acquire the disease if you have clean hands. So, wash your hands. So we've also got some videos that we uploaded on droplet precautions, the different types of masks, and the use of extended wear masks. So for time's sake, to keep this about 30 minutes, we're just going to watch the droplet precautions video. You can access our YouTube channel anytime and watch the videos. I will send an email with the link out to them as well.
Hi guys, today we're going to run through the correct way to put on your PPE and to take off your PPE as safely as possible. Hillary is our demonstrator today, so the first thing that you do when you're going to enter a room that requires PPE is hand hygiene. So Hillary, go ahead and do some hand hygiene. Alcohol-based hand sanitizer or hand washing for 20 seconds is appropriate. The next thing after your hand hygiene is complete is going to be to put your gown on. So once that sanitizer is dry, so we'll have you put a gown on. That gown is going to open in the back. So slip your arms in. The ties are in the back. There you go. Perfect. This can get a little tricky to tie it in the back, but go ahead and do your best. While Hillary's getting her gown tied up, there are 2 different types of face masks that potentially would be available for our residents requiring droplet or airborne precautions. An N95 mask, which is a higher level of protection for the person wearing the mask, is only going to be used in the cases of confirmed COVID-19 patients. Otherwise, yep, this is an example of an N95 mask. Otherwise, a surgical mask, the standard mask that we use for any type of droplet precautions, go ahead and put that on. Make sure it fits good over your nose and your chin. Squeeze it tight. Got a good fit. The next thing, which is a little bit different for what we're used to, is going to be eye protection or a face shield. So go ahead and put on your eye protection just in case of a splash or spray. And then gloves is going to be the very last thing that you do. And when you put your gloves on, you're going to want to make sure that the cuff of the glove covers the cuff of your isolation gown the best that it can to limit any exposed skin or clothing. Once you have completed full PPE donning, which includes gown, glove, mask, and eye protection, you can go ahead and complete your resident cares as you would. And when you're ready to exit the resident room, the first thing you're going to do, once you're 6 feet away from your resident, is remove your gloves by pinching the glove and removing it, and then going under the cuff, just like that. It's okay. And then just let it go. There you go. Put them in the garbage can. Perfect. Next thing that you're going to want to remove is your goggles, and you're going to want to take them straight off your face and deposit them in the dirty area. Then you are going to remove your gown. So you're going to need to untie, taking care not to touch the front of your gown with your hands. If your hands become contaminated at any time during this process, go ahead and do another level of PP or hand hygiene. So go ahead and remove your gown, Hillary, from the back and just peel it off so it's inside out. Perfect. Then you would roll it and put it in the laundry bin. In this case, it's disposable. It would go in the garbage. Now you perform hand hygiene. Perfect. Just great. Step out of the room and remove your mask. In the event that you're using an N95 respirator, those masks will be used multiple times over and over. You will not throw them away. For the time being, a standard ear loop mask is a one-time only mask. If you have any questions about donning or doffing your PPE or how to safely do it or anything else that comes up, please ask myself, Mallory, or Jen. Thanks, guys.
All right. So this I just threw up here because this is our droplet precaution sign, and it does show the things that you're supposed to wear: a mask, gown, gloves, and eye protection. So PPE is pretty important, and you've probably heard about just how important it is, due to the fact that there is an extreme shortage based on the entire healthcare industry's need for it right now. So just because people can carry and spread COVID-19 before they have symptoms, the extended wear mask that we're doing right now does offer some protection to residents and your fellow employees. If the person wearing it is infected, that mask will contain some of that virus to just the infected person. So that protects the people around you. It's not going to prevent you from getting COVID-19 or other respiratory symptoms. We're not really sure about the effectiveness of those cloth masks in doing that, but we do know that it offers some protection for other people. So kind of like, consider herd immunity. Think about if everyone's wearing the cloth masks and people aren't breathing their sick germs into the air, and they're getting trapped in those masks, then they're not infecting you. So it's positive. Please keep it on. I know it is very uncomfortable. Also, putting the newly admitted residents on droplet precautions protects employees and other residents if the newly admitted resident has COVID-19 but is not yet showing symptoms. N95 respirators will help protect staff taking care of residents who have been diagnosed with the virus and are on a closed unit, completing procedures that might cause the virus to be aerosolized. NEBS, O2, we talked about that a little bit. This virus isn't really airborne unless you're doing something to aerosolize it. So kind of keep that in mind when we're talking about using surgical masks and putting people on standard precautions or droplet precautions. Using those surgical masks over your cloth mask that you're wearing all the time. Just try to avoid, if at all possible, using those aerosolizing procedures. Also, try to reduce ER and hospital transfers. So notice changes in condition early. If a resident has a change in condition, some action should be taken. CNAs, please report to your nurses. Nurses, please follow up with those concerns and reports. Check on your residents, assess them. We all know how to do head-to-toe assessments, nurses. So make sure that we have a good, thorough assessment to report on and to document. Offer, if you got to call the provider for a changing condition or a sick resident, offer in-house diagnostics. We can do labs, x-rays, EKGs, we can do IV hydration, order stat meds, do strict INOs. We can put on oxygen, we can do antibiotics, we can do a lot of stuff. So try to make sure that whatever we can use at our disposal, our resources, that we're using those. ERs are really not controlled environments. The risk of exposure to our residents is so much higher in an ER than here at the nursing home, at their home. If residents' needs can be met internally, we should do everything possible to meet those needs. ERs are notoriously bad places to go if you have or if you're immunocompromised. Also, please make sure that you're calling the ER ahead of time if you're sending a resident there for respiratory symptoms. If you don't have time, please ask another nurse to do it. So this is not a scenario, we're not going to be able to do the you take care of your hall, I'll just take care of my hall type thing. We're not doing that. If someone asks you for help, help them. We're doing the extra cleaning. It's a lot of work, but it's worth it. We're using the disinfectants that we're supposed to be using. Cleaning frequent cleaning of those high-touch surfaces, shared resident care equipment. Please make sure you're wiping down your lifts when you're taking them in from room to room. Use the wipes in those green canisters. Use alcohol swabs to clean your pulse oximeter machines and your stethoscopes and your vitals carts between each resident. Nursing needs to fully sanitize rooms after visitors leave. If they're leaving after hours for compassionate care visits and housekeeping is no longer here. So you can do it with those wipes, just wipe down all the surfaces. And also, please make sure visitors are wearing masks. This is not necessarily to protect the visitor. A mask isn't necessarily going to protect them from getting something or being exposed to something. What the mask does is protect us, and it protects the residents if that person has been exposed or has the virus and is asymptomatic. If there's a positive case, nursing staff on the affected hallway, stop what you're doing, don full PPE. You do have bags set up in your nurses, in your med rooms on both floors with the N95 masks, the goggles, the gowns, everything you need. So put on the full PPE. In that email that I sent, I told you where you can find the other PPE, where you can find more N95 masks, more gowns, all of that stuff if you have to activate that isolation unit. Put a mask on the infected resident, get all the other residents out of the hallways. This isn't just a you thing at this point. This is going to require a couple people to help. Pull who you need to pull. Open that window, close the door, get the resident immediately to the isolation unit on first floor West Hall. Send the admit discharge email and letting us know which room you picked. Pick one of the rooms that's set up. Don't transfer any of the residents' belongings with them. Leave the belongings in there. Notify me or Emily right away. And check that policy. I'll send it out again on how we have to adjust staffing to staff that unit. As always, if you have questions about anything contained in this video, please ask one of us. We'll help you or provide resources for you.